Hello guys, myself Krishna, and today we'll be discussing mainly on adrenal insufficiency. In the previous video I taught you about glucocorticoids, the effects of cortisol on our body tissues, and at the same time I also taught about the Cushing disease as well as the Cushing syndrome, right? The difference between the Cushing disease and Cushing syndrome. So in this video we'll be concentrating mainly on adrenal insufficiency, and we'll be discussing what is Addison's disease, and we'll also discuss the types of adrenal insufficiency. So first of all, you need to know the basic thing. What is adrenal insufficiency? If adrenal gland is not able to produce enough substances, for example, if generally adrenal gland releases corticosteroids, mineralocorticoids and sex hormones. So if adrenal gland is not able to release this sufficiently, this is called adrenal insufficiency, and there are many reasons for that. So basically we divide adrenal insufficiency into three types: primary adrenal insufficiency, secondary and tertiary adrenal insufficiency, right? From the exam point of view it is most important, so please pay attention. So okay, let's discuss what is primary adrenal insufficiency. For example, look, decrease level of cortisol and decrease level of aldosterone. If adrenal gland is not able to produce enough cortisol and enough aldosterone, we call it as adrenal insufficiency. Generally we don't take the last layer into consideration, but in fact we mainly choose these two, right? Cortisol as well as aldosterone. Now look, as I told you, adrenal insufficiency is of three types, right? There is primary adrenal insufficiency, there is secondary adrenal insufficiency as well as tertiary adrenal insufficiency. Now, in primary adrenal insufficiency, what is happening is there are two phases in this. It is divided into two. One is acute phase as well as acute state as well as chronic state. So what is happening in acute state? Look, in primary adrenal insufficiency there are two: acute and chronic. What happens in acute? For example, due to trauma, if adrenal gland is destroyed, can adrenal gland release cortisol and aldosterone? No. So when there are no enough sufficient release of cortisol and aldosterone as a result from the destruction of the adrenal gland, it is called as acute primary adrenal insufficiency, right? So acute primary adrenal insufficiency results due to trauma, right? As a result of the trauma there will be decreased cortisol as well as aldosterone levels. Now how to differentiate between all of this in the labs, I'll be explaining it in a bit. So before that, just remember that acute due to trauma and chronic adrenal insufficiency is due to what happens in chronic adrenal insufficiency? Chronic adrenal insufficiency, our own antibodies, they affect the adrenal gland and cause destruction of the adrenal gland, right? So we call it as autoimmune destruction of adrenal gland or adrenal atrophy, right? So autoimmune destruction, it happens very lately in a long period of time, that is why it is called chronic, right? So if adrenal gland is getting destroyed due to autoimmune processes, the same thing, it will not produce cortisol and aldosterone. This chronic primary adrenal insufficiency is called as Addison's disease. Addison's disease is chronic primary adrenal insufficiency which is caused due to autoimmune destruction of your adrenal gland. So this is called as Addison's disease, right? Now coming to the secondary. Okay, let's finish it up primary and then we'll enter into the secondary. Now what is happening in the primary? What are the things that are going to increase in the blood in case of primary, and what are the things that are going to decrease in the blood in case of primary? So adrenal gland is destroyed now. Adrenal gland is destroyed completely. Adrenal gland is destroyed. Now when adrenal gland is destroyed, what happens? There will be decreased production of cortisol, right? Now look, when there was increased production of cortisol, this increased cortisol negatively it inhibited this anterior pituitary so that it should not release any more ACTH, right? Then what happens with the decreased cortisol? When there is decreased level of cortisol, this triggers the activation of anterior pituitary, and anterior pituitary releases ACTH, and this ACTH acts on the adrenal gland and cause release of the cortisol. But in this case, the same thing happens. Look, in this case what is happening? Adrenal gland is destroyed, decreased cortisol. This decreased cortisol triggers positive feedback mechanism, not negative. So in this positive feedback mechanism, there will be excessive release of ACTH. Now look, this ACTH, can it act on the adrenal gland? No, because adrenal gland is destroyed. So overall what happens? Cortisol levels are reduced, but ACTH is continuously being secreting out, right? So as a result, ACTH levels will be constantly increased. So in a patient with acute primary adrenal insufficiency, you will find increased ACTH and decreased cortisol levels, right? Now one more thing, increased ACTH and decreased cortisol level. What is another way to just, what is a clinical diagnosis? By seeing the patient, you have to tell that he is of primary adrenal insufficiency. It is hyperpigmentation. When you pull the lips down, there is a mucous membrane, right? The mucous membrane turns to dark in color. This is called hyperpigmentation. It is seen only in case of primary adrenal insufficiency. Why? Look, normally what happens is, from the hypothalamus there is a nucleus called PVN, paraventricular nucleus. Look, this is the nucleus, and this nucleus is named as paraventricular nucleus. This nucleus releases a hormone, and this hormone, you name it as corticotroph releasing hormone, CRH, right? And in the anterior pituitary you have some cells. Look, there are some cells. Some are called thyrotropes, which release thyroxine. Some are called corticotropes, which release ACTH. Some are called lactotropes, which release prolactin, right? For example, this is a corticotroph. Now this CRH, look here carefully, this CRH, this is a corticotroph, right? This CRH activates this corticotroph, and corticotroph releases ACTH. Now in this condition, there is excessive release of ACTH. Why there is excessive release of ACTH? Because cortisol levels are dropped down. So positive feedback mechanism and increased level of ACTH. This increased ACTH, what it does is, this increased ACTH activates another type of cells called melanotropes. This cell is called melanotropes. Now this ACTH activates this melanotropes, and melanotropes release melanin. What is the function of melanin? Pigmentation. So increased ACTH is causing hyperpigmentation. So in primary you will find hyperpigmentation, right? So that is the main thing you need to remember, or you can just remember it right. Primary stands for P for pigmentation, right? Now what is secondary? So we finished primary adrenal insufficiency. What is happening in primary adrenal insufficiency? Increased ACTH, decreased cortisol and release of melanin. So you will find hyper pigmentation, right? And even I wanted to discuss one more thing here for your exams. Look, in primary adrenal insufficiency there is a syndrome called Waterhouse-Friderichs syndrome, or simply Waterhouse syndrome. In Waterhouse syndrome, what is happening is, Waterhouse syndrome is an acute primary adrenal insufficiency. What is happening is, there are three things that are happening in Waterhouse syndrome. The first thing is endotoxic shock, and the second thing is septicemia, and the third thing is disseminated intravascular coagulation. Because of all of these three, the adrenal gland cannot produce enough amount of adrenal gland cannot produce enough amount of cortisol as well as aldosterone. So that is called as Waterhouse effect. So let me write it here. That is called Waterhouse syndrome. Waterhouse syndrome. What is the triad of this Waterhouse syndrome? Disseminated intravascular coagulation. Second thing is endotoxic shock, and third thing is septicemia. Now, what is causing septicemia? Neisseria meningitidis. Neisseria meningitidis is causing septicemia. This is the most important thing which you need to remember, right? So this is all about the primary. Coming to the secondary. In secondary, what is happening? Look, in primary, main thing you have to concentrate on the gland. There is damage of the gland. But in secondary, you have to concentrate on the anterior pituitary. For example, due to trauma or due to any other thing, if there is damage of anterior pituitary, will anterior pituitary release ACTH? No. When there is no release of ACTH, will anterior pituitary can activate adrenal gland? No. When it cannot activate adrenal gland, can it release cortisol? No. So as a result, level of cortisol will be decreased. At the same time, level of ACTH also will be decreased. So when ACTH levels are reduced, when there is no ACTH, then there is no hormone to activate melanotropes and cause release of melanin. When there is no release of melanin, then there is no pigmentation. So in secondary adrenal insufficiency, there is no pigmentation. This is the important thing. Secondary adrenal insufficiency due to anterior pituitary trauma or decreased production of ACTH in any way. So in secondary, there is no hyperpigmentation, right? So yeah, in secondary there is no hyper. What is tertiary? In tertiary, there is no problem with the pituitary gland, there is no problem with the adrenal gland. But if the patient is under a chronic use of, chronically is administering corticosteroids from a long time, right? If he is taking corticosteroids from a long time, so these corticosteroids which are given exogenously are called exogenous corticosteroids. So when exogenous corticosteroids are given, this leads to adrenal insufficiency. When exogenous corticosteroids are given, this causes decreased level of cortisol. Why decreased level of cortisol? Because when you are giving exogenous corticosteroids in the sense the cortisol, so the level of cortisol is increased. When the level of cortisol is increased, it causes negative feedback mechanism, causing decreased secretion of ACTH. When there is decreased secretion of ACTH, what happens? Obviously, in a period of time, adrenal gland also will not release cortisol. As a result, exogenous corticosteroids are leading to exogenous corticosteroids lead to adrenal insufficiency in this way. And anyways, it's not important, but you just need to know what is tertiary adrenal insufficiency. Tertiary adrenal insufficiency is due to exogenous corticosteroids. Now, exam point of view, they'll mainly focus that they'll give you some symptoms. A patient was having some problem with adrenal gland, later on he developed hyperpigmentation. So, what type of adrenal insufficiency is it? If you find hyperpigmentation, it is primary. If there is no hyperpigmentation, it is secondary. If a patient is having adrenal insufficiency, but there is no problem with the pituitary and the adrenal gland, and he has been under prolonged use of exogenous corticosteroids, then it is tertiary adrenal insufficiency. Now, how to remember all of this? Look, very simple. So, exam point of view, what I told, just remember those. Okay? Primary, secondary, and tertiary. So look here. So in primary, the first letter is P, secondary S, tertiary T. P for pigmentation. So in primary adrenal insufficiency, you will find pigmentation. Pigmentation of what? Pigmentation of mucous membranes. Secondary, S for spare. Secondary spares mucous membranes. I mean, it leaves mucous membranes. It does not cause any pigmentation of that mucous membrane. So secondary spares mucous membranes. So spares mucous membrane in the sense it does not affect the mucous membrane. As a result, there will be no pigmentation, right? Tertiary, T for treatment. If a person is treated with exogenous corticosteroids from a long time, T for treatment. What treatment? Exogenous corticosteroids. Treatment, that is exogenous corticosteroids. So, primary, secondary, tertiary. One more important thing. For example, if a patient is having TB or if a patient is having candidal infections, of course he'll go to the clinic, doctor will give the tablets, doctor will treat him, finally TB is gone now. Or else if he is having candidiasis, now there is no candidal infections now, right? Later on in his life, if the patient takes exogenous corticosteroids, there is a chance for the TB and candidal infections to relapse. They may come again. So before giving exogenous corticosteroids, you need to make sure that the patient had no past history of tuberculosis and no past history of any candidal infections, right? So exogenous corticosteroids can cause relapse of TB and candidiasis, right? So for exam point of view, this is enough, okay? But if you wanted to know everything about adrenal insufficiency, then you need to study, right? So that's it. So these are the 3 different types of adrenal insufficiency. So yeah, thank you for watching my video. This is Krishna signing off Medical Tutorials.